Greetings, Clinic family. It's good to be with you again for another fireside chat here with my partner, Dr. Lipinski. This is our first update in a few months since the COVID epidemic began back in March. We wanted to update you on our response to that, how our policies and procedures have changed, and how we're caring for you in this different time that we're all living through together. So we're going to jump into some frequently asked questions that we are getting, which we hope for those of you who choose to view this, we can speak to you all about questions that we're getting individually from many of our members. So the first question is, are we seeing patients in the clinic? The answer to that question is yes, and it has been yes throughout the COVID epidemic, but the degree of severity of conditions that prompt us to see people in the clinic have changed. So when things first started back in March and the governor issued a stay-at-home order, we were, like everybody else, attempting to minimize interactions with other folks. Our nurses were working from home, and my partner, Dr. Lipinski, and I were here seeing patients whose conditions absolutely required us to see them. And we relearned as doctors in that time that it is important for doctors to see their patients and for us to be physically together, both for diagnostic purposes and therapeutic reasons. The obvious things of stitches or things that you cannot do over the phone, but also to better understand symptoms. Anyway, for all those reasons, we are relieved that we are able to see you for whatever you feel is necessary to be seen for. So to all of our patients, we say, if you would like to see the doctor, we are glad to see you, and we're taking steps to make sure that when you come to see us for one thing, you don't contract another thing. So we don't want you to contract COVID or any other illness when you come to see us, but we believe that we're taking steps to make that risk minimal. And I'll have Dr. Lipinski speak to you about those precautions that we're taking.
Thank you, Dr. Fischer. So as Dr. Fischer said, we are taking steps to try to minimize your exposure and keep our clinic as safe as possible for a place for you to come. Our nurses previously created a video to walk you through the process, but I'll review some of that. First of all, we are trying to keep patients who are highly suspected of having COVID outside of our office walls, so that, again, there will be no viral particles floating in the air or on surfaces. And so the first step of our safety measures are to triage you by telephone, and in doing such to figure out the best way to go. If we do have COVID patients that need to be seen, we're trying to see those folks out in the parking lot. Again, is to try to keep exposure to a minimum. The next thing that we're doing is we've temporarily suspended our in-house waiting room, and so when you come, you will have directions to wait in your car with either the air conditioning for the summertime or the heat for the wintertime to keep you comfortable, and you'll call and their nurses will again do a quick triage to be sure that you haven't had any COVID symptoms or been exposed or any travel or that sort of thing. And as long as that's okay, the nurse will come and meet you at the back door. We'll get your temperature, and as long as that's okay, the nurse will then bring you straight to your exam room. And from there, we'll do our exam and take care of your needs. And then afterwards, we are doing a more thorough cleaning of each room and all the surfaces in the room after you leave, so it'll be clean for the next patient. We're also rotating rooms, so that the room that's just cleaned has a little bit longer time to disinfect and again to be clean. The other thing we're doing is we're keeping the HVAC system running continuously to circulate the air. And then finally, as we're everywhere else, we ask that you wear a mask and we wear masks to try to minimize exposure. And then the final thing that we're doing to try to help you is we are offering in-house lab draws, so that you don't have to go to LabCorp if that concerns you, of being there waiting in line, have to sit in their waiting room, and just being exposed to a bigger group of people. And so if you have labs that need to be drawn and would like to have them here, we can arrange a time for that, and it can be scheduled, and you can do that here. Dr. Fischer is going to talk further about some other lab issues and lab changes that will be coming up.
Thank you, Dr. Lipinski. Yes, we have long wanted to offer more of our lab work and other services that historically in the 4 years we've been operating, we've had to have folks go elsewhere to get their blood drawn, to get vaccines, things of that nature. And the COVID time has accelerated our thinking about that, or our planning about that, such that we would like to be able to offer within the space where we have the privilege of controlling it and making it as safe as possible. We'd like to invite our patients in to have their blood drawn, have vaccines, have certain testing within our space. And that requires some increase in staffing, for us to rethink some of our plans and procedures around that. I'm not going to go into all those details on the video, but we would invite you to read the update that we'll be sending out with detailed information about those changes. But the spirit of them is, in general, that we want to take better care of you, expose you to less risk for infection, offer more services within our space than we've previously been able to. So the next question, I'm going to keep the camera on me for a minute, and the next question is sort of a sub-question of the first one I asked, which is, are you seeing patients in the clinic? The next question we get often is, should I come for my physical this year? And my answer to that is similar to what I said in the initial one, which is that if you would like to be seen for your physical, we would like you to come. So not to put it all on you, but ultimately we feel that we can create a safe environment for you to be seen. And that has also prompted me to ask the question, well, what is the value of a physical, and should I come? And my mind in thinking about that question went back over the last year of my clinic visits, and I can recall one patient who came as a healthy man thinking that he was just coming for a checkup, and he wound up having open heart surgery for a problem identified on his examination during that visit. Another patient who came feeling a little short of breath, and identified through some blood work that ultimately that she needed to have a colon cancer removed. And I mention those stories not to scare anybody or say, oh boy, I better go in or I'm going to have a ruptured aneurysm or cancer. I mention those stories to say that my thinking over it has reminded me that having a physical has value, and I think we wouldn't do them at all if they weren't worth doing. The rarity of times will it identify a life-changing problem, but even if it doesn't identify a life-changing problem, we find value in physicals from the physician side in maintaining our relationships with our patients and in refamiliarizing ourselves with your situation, restudying each of you every time we see you, looking back over the year, making sure that there's not things that have fallen through the cracks, and establishing a new baseline on how your health is. Those are all the reasons that we think a physical is valuable, and we would invite any of you to schedule. I will say on a personal note, my physical fell in March this year. It was canceled, like all those things in March, but I still did get my blood work. I have some patients who are choosing, it's not an all or none option. I have some patients who choose to get their blood work and then call me on the phone, or I call them, or we have a telephone appointment, which is, it's not the same as having an in-person physical, but it's something, and it's okay. It doesn't have to be an all or none. So we're able to accommodate and do things according to your preferences and what feels right to you. But so with that, I'm going to turn it back to my partner and go back to the topic of the day and turn it back to COVID. So Dr. Lipinski, if I suspect as a patient that I may have COVID, what should I do?
So if you suspect you have COVID, or you've been exposed to someone with COVID, and you're concerned you may be an asymptomatic carrier, we have a site on our website that gives you some basic information. Again, if you're mild symptoms or just concerned that you're a carrier, we have on the site some places that you can go and be tested, and that changes from time to time just based on our patient experiences, the availability of the test, the cost of the test, the turnaround time, And so again, if you have any questions on mild symptoms and testing, check that site out. If you have more severe symptoms, or you just have a question or want to speak to us, feel free to call us and we'll talk to you on the phone and triage and figure out the best next steps for you as far as being tested, being treated, and more specifics on your individual care. We are in the process of trying to have a testing here ourselves. We're working with Mako Labs. At this point, we're just getting started. The cost of the test here for us to be able to administer is $185. Some of the sites that we've listed on our website are a lot less expensive, and several of them have quick turnaround now, so those are probably better value for you. If for some reason you can't make one of those, or you have another issue, then you can call us and we can schedule a time for testing here. In order to try to keep the office, again, as a safe place as possible, that testing will probably be done in our parking lot. And so one of our staff will come out and do the swab in the parking lot with full protective equipment on, and then we'll let you know as soon as we get those tests back. Our turnaround is about 24 to 48 hours. Again, some of the other places are UNC, especially, I think more recently, have been able to do that. But again, just check our website. If you have any questions, you give us a call. What to do if you have more severe disease, again, call us. How to prevent becoming or having more severe disease. And just like anything else, just like the flu, is to remain your daily habits to be as healthy as possible. A healthy diet, eating whole foods, avoiding lots of concentrated starches, trying to be as healthy as possible with your exercise. Don't smoke, maintain a healthy body weight, and all those sorts of things. People ask us frequently, should we take vitamins and minerals, and most people who eat a well-balanced diet will be able to get all their nutrients that they need through their diet. If you have an absorption issue, or just because of preference you don't eat a well-balanced diet, then a multivitamin might be beneficial. There are questions about vitamin D and zinc, and I think the data is conflicting, and so I don't think those will hurt you. They may be helpful. I don't know that we can say that for sure. There's also questions about the hydroxychloroquine, and again, the data is all over the place, and depending on who's promoting it, you get one answer that's argued well, and another answer from someone else who's argued well. We tend to get our information from an online source that we subscribe to called Up to Date. It seems to be, I guess, better balanced and well-rounded. And at this point, they're not recommended any of those treatments, especially for outpatient. There are some in-hospital studies for that medicine and a couple other medicines, but again, those are under strict protocols and are not for people in the community to prevent disease or to make their disease more mild. If that changes, we will stay abreast of that and treat our patients accordingly. And again, if you have any questions about testing, about your symptoms, check our website out. If that's not sufficient information, we're always available for you to call. I will now turn back over to Dr. Fischer for further discussion on treatment if you were to happen to get COVID.
Great, thank you, Dr. Pensy. Yes, and we are anticipating flu season. Just to dovetail a little bit on what Dr. Pensy said, we are anticipating flu season with some trepidation, as much of the nation is trying to anticipate how we're going to figure out when people come with a fever and a cough what they may have, and we will continue to look for the most most rapid turnaround on testing and the most cost-effective testing we can find for you. So the reason we're directing you to the website is those things change, and we may be able to find that within ourselves. We hope we can. What we currently have that's quick is not as cost-effective as we would like, but we'll keep working towards finding the best option. And again, that will probably change as one lab gets overrun and another one becomes more available. So it'll be a moving target. But I'd like to speak to how we're treating people with established COVID. And I'm thankful that our track record so far for patients in this clinic is that we have had nobody hospitalized and nobody severely ill from COVID. We've had a good number of patients, and we have patients who have it now. It's very prevalent in the community, so it is around. we are glad that we're, for everybody so far, including the young and old and people who are sicker and healthier, is that we have treated them symptomatically, which is to say rest and fluids and all the normal things that we would recommend for a virus, no specific remedy. But we anticipate, as is inevitable in any population of people, at some point we're going to have some folks who are really sick and who are going to need to be hospitalized. And we want to reassure you that if you need treatment, we will treat you. And our accumulated clinical experience is with mild COVID, which happily we're learning is the norm. It is rare that people get very sick, but the folks who know about treating very sick people are the intensive care doctors and the infectious disease specialists in the hospital. And should you need to be hospitalized, we will avail ourselves of those experts and the accumulated experience and wisdom that they have, so that we will treat you as you need. But you are being under our care does not mean that we won't avail you of the best care and the best experience that's accumulated on treating the more severe form of COVID. Dr. Lipinski, let's see, what was I going to ask you next?
Final question is Dr. Fisher's question, and is whether or not we're taking new patients or not at this time.
Good. Oh yes, I guess I'm still talking. So we are flattered that we have more requests for people who would like for us to care for them than we have capacity to care for them. So we set out with a mission of providing personal and high-quality healthcare to all of our patients, and there is a number of people that you can do that well for, and then at some point, if you try to do it for too many people, you don't do it well for any one person. So we have felt that we were approaching that point where we really couldn't take on new patients, and then during COVID, when we definitely did not feel right about taking new patients, for much of that time we couldn't see people. Long and short, we feel that we are pretty much at capacity at this clinic, and as things normalize in the coming months, we will look internally and see, make an assessment of how many folks we can take on, and we've been carrying a waiting list for longer than we would have liked to during this time. We want to honor the people on that waiting list. We want to speak to those of you who have sent friends and family here and say we're not ignoring your friends and family. We're just trying to take good care of you first before we make promises to new folks. But we're going to be very shortly looking through our list, taking the folks we can, and then saying, drawing a firm line when we say, okay. In fact, as I say that, I think we're going to say we can't add anybody to that list, but we will soon take people off that list. We have been very pleased to introduce the community, introduced to the direct primary care community, which is our way of operating here in this clinic. Dr. Melissa Reed, who is already known to the Raleigh community. She's been a physician here for several years. We've enjoyed meeting her and talking with her, and are recommending her to any of our patients who have friends or family or other people they'd like to refer, who appreciate the way that we practice, and are principally interested in people who are setting out to practice in the way that we do, but it would not be us per se. Anyway, Melissa Reed is opening her practice this month, and we'll have information on our website about how to contact her clinic if you would like to be a patient there. Dr. Lipinski, do you have anything else to say on that topic?
No, I agree with what you said. We're thankful for the opportunity to take care of each of you, and we thank you for sticking with us and being patient with us as we adapted to this time. Kind of a privilege to be able to care for each one of you, and to be able to continue to do that at a level that we would like. We really need to shut down to new patients for now.
Thank you, clinic family. Look forward to seeing you in the office whenever need arises or whenever your physical comes around. And I think we're approaching something more close to to normal in our day-to-day operations, and that feels good for us. We hope it will feel good to you to come here and have a safe place where we can take care of your medical needs.
And we hope to see you again soon.